Hi everyone, Teddy Brose here from Lynchburg, Virginia. I'm a family doctor that's been in practice for about 5 years and have a huge passion in preventing, treating, and reversing chronic diseases. I am board certified in family medicine as well as lifestyle medicine, and I went seeking for this additional board certification because I found that my medical school education severely lacked any sort of knowledge or education on how to actually teach my patients lifestyle medicine. So that's where that came from. I wanted to chime in since it's Heart Prevention Month and give you a little bit of my thoughts on the subject. I first became interested in lifestyle medicine when I was a third year medical student, and this was through my own personal journey with my health. At that time, I was approaching morbid obesity, which was really difficult for me because I actually used to be quite an athlete in high school, and I also had gotten some pretty unhappy test results. I had a very high cholesterol that was approaching 300 and elevated blood pressure at the age of 34, which was kind of devastating for me at the time. And I found myself really lost. I felt like, as a medical student, I should have had the answer to this problem. And I found that I really didn't know what to do. I was just very lost, and went home one night and was discussing this with my husband, and he pretty much put his hands up and said, I don't know what to do. I don't know how to help you, but I will do whatever you want me to do. And we kind of left it at that. The very next day, I remember sitting down. It was a Sunday morning with a cup of coffee. It was a rare day off, and I was flipping through the channels, and here on PBS was this doctor, and he was talking about food as medicine, and it was Dr. Furman's Eat to Live special, and I looked at that, and it was like, why am I not being taught this in medical school? And pretty much devoured everything written by Dr. Furman at that point, and started following the Eat to Live plan, and never looked back. Later have had the pleasure of meeting him several times, and having being him being further inspiration to me. And so that's kind of where it all started. Later on, as I went into residency, I had the opportunity to begin some work with my patients and begin counseling them about lifestyle medicine, but really was using my own personal experience. I still didn't have any real knowledge on how to motivate people, how to coach them through this, how to really even let them know, can chronic disease really be reversed? Like, what do we tell them? And at that point, I started really looking into getting some additional training, and ran across the American College of Lifestyle Medicine, and that is where I started to take a real interest and get real education on how to really coach people through this. So why do we care about lifestyle medicine anyway? Well, we really care because the top 15 killers in the United States are all foodborne and lifestyle-borne illnesses. Everything from high blood pressure, from back pain, to acid reflux, to, of course, our number one killer, which is the whole kind of the star of this month, cardiovascular disease and cancer. And so I just want to share some facts with you guys about heart disease, and just get you, and I kind of give you an idea of why this is so important. Heart disease is the number one cause of death for men, women, and people of most racial and ethnic groups in the United States. One person dies every 37 seconds in the United States from cardiovascular disease. There are 647,000 Americans that die from heart disease in the US each year. That is 1 in 4 deaths, and rising. And the cost to us is almost $220 billion per year. This is our cost. More women die of heart disease than cancer, and cardiovascular disease causes 1 in 3 deaths of women in the United States. More women die of heart disease than men, but we typically hear about the male heart attack more often. Women have a higher lifetime risk of cardiovascular disease than men, and it's estimated that at least 80% of heart disease and strokes can be prevented with lifestyle medicine. This last piece is the key. At least 80%. Can you imagine that? I mean, when I learned this information, I was like, how can I not discuss this with every single one of my patients? It's just so important. And so, what is really missing in our medical model? Well, we really have, from the moment I started, I initially had gone to nursing school before I went to medical school, and it really wasn't terribly different there. From the minute that I remember the very first class that I ever took, even in nursing school, we focused on how disease is formed as far as the pathophysiology, but not necessarily the cause. And from there, it was, how do we treat it? How do we manage it? It was never about prevention. It was never about reversing disease or fixing the cause of disease. And so we have the system of sick care in the United States. We don't really have health or well care, and this is the problem. And it's not really taught in nursing schools, and it's not really taught in medical schools. And I think that we are going to see this change in the near future. I'm very hopeful. We're actually seeing some medical schools introduce lifestyle medicine into the curriculum, and also cooking classes, because this is so important, because some of these new generations don't really know how to cook their food. So what can we do? What are some practical steps that we can take? Well, I'm going to tell you, it's mostly about the food, but it's not all about the food. So probably the 3 biggest things that we can do is, number 1, we must eat more plants. We really, really need to focus on eating more plants, more fruits and vegetables, whole grains, beans, legumes, and nuts and seeds, and whole grains, and in particular, green leafy vegetables, because they are the lifeline for our blood vessels. They are so rich in this substance called nitric acid. I'm sorry, not nitric acid, nitric oxide, that it just bathes our blood vessels and allows for them to repair and dilate and to function properly. So we need to have lots and lots of green leafy vegetables. We also need to eat fruits, and we need 7 to 11 servings. What is a serving size? Well, serving size is about the size of your fist, and each your fist is for your body, so about the size of your own fist is 1 serving. So 7 to 11 a day for you to meet your basic requirements. So if you're an athlete who exercises a lot, you may require more servings than this. And then what's step number 2? We got to get rid of the processed foods and dairy products in our diet. They're extremely inflammatory. They are highly processed. They're very high in fat, and all of these things just add to the reason why we have heart disease. And number 3 is that we need to eat less animal products in general. And then if you want to go the extra mile, you really need to get out there and move more. And also, don't smoke, drink as little alcohol as possible, and have a daily meditation, relaxation, or prayer, or some sort of breathing practice that helps to reduce your stress levels. We can't take away our stress, but we certainly can reduce our response to that stress. So I know that was more than 3, but I really think the first 3 I mentioned are probably the most impactful. And then after that, it's the gold star items. That's it. I hope you find this video helpful. And remember, eat your fruits and vegetables.